Like a little frustrating. So you're like a leopard.
Yeah.
All right. What we're going to finish here is talking about leukocytes, platelets, and your clotting factors, and then we'll talk about vascular disorders on Tuesday. And the focus on Tuesday will be the first hour. I will finish up with the vascular disorders, and there's some commonalities with them also. And then I'll talk a little bit about blood in general, but you won't be giving blood, and there's a lot that you need to know about blood, and some of the complications that occur related to blood. And when we talk about blood, we'll talk about certain religions that may not believe in agree with blood. So, with that being said, okay, how would you know someone, lab-wise, someone had an infection? What would be elevated?
White blood cells.
Leukocytes would be elevated. With some infected process, you'll look at your differentials like eosinophil, basophil. There will be shifting. But predominantly, you're going to see an elevation from the norm range in the leukocytes, the elevation. What would you see in your patient? Let's say I'll choose this. Let's say I had cellulitis. Okay. And cellulitis is on my face. What would my face look like if it's all red, inflamed? Okay. Why would it be red and inflamed? Because the infection is there, and anytime that there's an insult, even from infection, blood supply goes there. It's expedited to try to fight that infective process. But with you need something to help fight that infection, even though you think, oh, that person has the white blood cells, and heaven help if their immunity is low. You need something to help them. What pharmacological agents? Broad group thinking. Antibiotics. What type of question?
So, if the red blood cells are going to that area to try to help fight the infection,
Not only red blood cells, but in your blood, you're going to have
the white blood cells.
White blood cells, but
so if
they're
it's all
elevated.
going to that area to try to fight that infection, why do we try to get the swelling and the redness out of it? Would that be counterproductive?
No,
Because if it's there to fight the infection and we're putting whatever on it to try to get the swelling down.
You want to put that swelling down. However, at the same time, you need an antimicrobial agent in the form of an antibiotic to fight that infective process.
I understand that, but if the blood's going there to help fight the infection, why do we try so hard to get blood out of that area?
Because you're thinking there's an inflammatory response where that a person can have inflammation without infection, but this person has inflammation and infective process. And so you want to help both areas. The person got edemesis in the first place because of the inflammatory response.
Okay.
Yes,
I
you want
guess
that
it's the same
edema
thing like
down.
a fever, like you get a fever and your body gets taught to fight off the germs that are in your body. But yet we give Tylenol to stop the fever.
I think what you're,
Right?
I always wonder.
I kind of, so if we didn't do any interventions, then our body would
That is our
perhaps
body's way of fighting stuff
It's
off.
maybe
trying to
actually
we're trying so hard to
fix the
stop
problem, but since we always intervened, we're counteracting. So if we weren't going to give antibiotics, then fine, we just let the disease process go and see how far it could go.
Yeah.
Is that what you're?
I
kind of.
I'm just saying we have this built-in thing in our body to fight off these things, but then we're trying to stop all the symptoms because we don't like how they feel.
Okay. It occurs, but the thing is, you don't want it to proliferate where it's out of control.
Yeah.
So you intervene with antimicrobials, antibiotics. But that inflammation, you you want that process to occur, because that's our body's trying to fight.
Exactly.
But the problem with the inflammation, you want it to come down. That person's in pain.
Yeah.
You want that inflammation. It affects the vasculature. It affects mobility at times. It goes into the neck and what have you. But I think you're thinking a little bit deeper than what you need to. Just know that a person can have. I know
I
you.
just always wonder that if
Okay.
like a fever is supposed to help fight off something, why don't it stop the fever?
But if
Even if
it's
it's
not
low
doing it fast enough, you gotta give something, because you're gonna have complications. And I'll digress and say this: if you don't give an antipyretic to a child, if you just let it go, what's gonna happen? They're gonna have a seizure. They
Well, I
get
mean,
more
if it got to
listless.
be like 103, 104, yes, but when
You're
you
thinking deep.
sorry.
Don't need to.
Don't think.
Don't need to.
Okay.
Something
I
needs
just
to
always
know.
wonder about that.
Okay. So you give antimicrobial. But if that person had drainage from that site, what would you know you need to obtain before you obtain
Culture.
cultures? And cultures are done so you can see what you'll get a broad spectrum antibiotic that they'll give initially. But then the sensitivity will highlight the med that you want to continue. So infection. Now, there's going to be times when you have elevated, and that'll be talked about in cancer, where you have too many leukocytes, but they're immature. So that's a different form of, it's not an infective process, it's a type of cancer, leukemia. That's why it's addressed when you have your cancer lecture. I think of leukemia, and we're not going to talk about it now. I think about it as, you know when you have all your family members come over, and some of them just act like food. And there's so many of them, you love to see your family members, but too many of them getting together, it just causes trouble. You can even relate that to it with polycythemia. Too many of them, they get together, they make everybody just want to be raged. There's too much circulating red blood cells. You even have trouble when you think of blood dyscrasias or blood problems. When you have a family member, when you have a gathering and not many people show up, they still can start trouble. They're circulating and mixing around, but they still can, not many of the relatives, but they still can start trouble. Think of that when you think of blood. Be it too little or too much, it's going to cause a problem. With anemia, too little of them, you're going to have those manifestations, except for vitamin B12. It's going to be different. With the white blood cells, you usually think too many of those leukocytes, it's an infective process. But if they suspect that it's a blood-borne cancer, what they'll do is do a bone biopsy. I know a lot of you have. How many of you have experienced someone having a bone biopsy? I'm just going to tell you it needs to know whether it's a bone biopsy. Before a person has a bone biopsy, and by it, they have, it's usually the hip, the crest of the hip that they take that bone aspiration, or sometimes it can be sternum, that's the issue. What type of blood lab work would you need to have before they had a bone biopsy? Highly vascular bone.
PTT?
You're right. Your PTIR, PTT. You would need to know a baseline CBC. And you need to know your electrolytes too. Yes.
I may get a bone marrow one today. If they need to like through
Oh
your
yes.
bone.
And they do it at bedside a lot of times in hospitals. They,
Painful, very, very,
very
very
painful.
painful.
And it's a large bore needle.
Is it like a 14 gauge or like a
Close to it. And the person you get the patient consents, there's a local analgesic that is used, and they go, of course they have x-rays prior to, they go right into the bone and
We're just thinking about it.
it penetrates the bone.
Why do they only just do a look? Do they give you anything else. I mean, kind of.
Yeah.
Like a
They just
balance.
knock you out.
So back you there.
Yeah, I don't want to be knocked out.
Yes.
The 40%.
I had a friend growing up, and I never understood it, but he had leukemia, and he had to go like every few months to get that done.
Because they wanted to know if the therapy was working.
Because he
They
was
need
always,
to look at.
they even do that to little kids.
Oh, yes. And the mama becomes a patient almost as much as the kid.
Just really like a quick definition, what is thrombocytopenia?
Thrombocytopenia.
We
That's
see it on our stuff all the time, and
Thrombocytopenia is you don't have enough circulating platelets. You're below 250,000. Remember I said no numerals, okay? But your platelets are low. So if my platelets are low, what might you see manifest on my body? Bruising.
Papira or whatever it's called.
The TPI is a little tiny purpura is bruising all over. Like yesterday, I think it was Ramsey. I looked this way with his arm. If he had thrombocytopenia, just by me hitting that capillary network, he would have bruised that. Of course, I know he told me he bruised. Okay, but bruising would occur. So, what would you see in a person with this low platelet? Petechiae. They're prone to PETCHIAE. Okay. You will also see that if they have a problem, not enough platelets, what might you notice that may manifest in the stool?
Blood.
Blood, because if you have any type of bleeding problem, especially if you got hemorrhoids or whatever, anything. Okay, what might you notice in the urine? Blood may be there also. If someone has a problem with thrombocytopenia, you give them an injection, any type of injection, what might happen?
What would keep bleeding?
They would keep bleeding. You would have to hold extended pressure to that site.
Like if they're taking an anticoagulant.
Huh?
Like it's like you would like if they're taking an anticoagulant.
They're more prone to bleeding, just like if they were taking anticoagulant, but they're not taking it. They don't have enough platelets to cause a thrombus, so a clotting of that area. Yes.
So I need to go back to this, but so somebody's getting a bone marrow transplant.
Hemophilia is a clotting deficiency.
No,
That's just it's
just enough so that they can analyze.
My friend's got
the
that.
NRCRG.
She had dentist surgery.
And
She
they
knew
look at
she
it
had it.
outside.
Oh my god, she just wouldn't let it stop for like 4 days. Just spitting comments out. That's how she found out. She had emergency surgery.
Yeah.
And she
They
had
don't have
stitches, but
enough
it wasn't.
You'll
Just
give them
a nut,
you give them
you
platelets.
Yeah. Every time I get pregnant, I have really severe thrombocytopenia where they actually put me on bed rest for the last like as long as I can go. My platelets drop, and they can put me on steroid. They put me on steroids like real.
So you don't have, steroids are used, yes, for anti-inflammatory, but it helps for that you're not gonna have a condition due to the rapid growth.
But they
of
did
age
have
and everything.
platelets. They had blood by the side when I was pregnant.
Right. Because they don't want you to diminish your production any further.
I got to like there.
Okay. If they get an infusion of platelets, you treat it as getting any blood product. And we'll talk about blood product next Tuesday. But these platelets, they generally aggregate together anyway, so you get these platelets fast. It's a fast infusion. And they have to, until you hang the next bag of platelets, they rotate it so that they don't aggregate together. So, moving on, there's other people who here, who, the clotting factors, where's your clotting factors formed in your blood? Where is their core?
Spleen?
The plasma.
Oh.
Okay, you're right over there. Okay, your organs that aid in the clotting factors, the production and destruction of your red blood cells, leukocytes, any of your blood cells, it's regulated in their production by spleen. So that sickle cell person where they're having production and destruction, they may have splenomegaly, and that's just enlarged spleen. But getting back to what I was saying, with these clotting factors, they use cryoprecipitate. That's a process, just kind of know, cold, freezing. They get these from the plasma, cryoprecipitate, they use clotting factors. Hemophilia is usually one that is inherited. The mom, the mom usually gives that to the son. A son, if a son is born with hemophilia, who is the causative agent? Usually the mom. Other people can have hemophilia also, but highest incidence is mom and male, their male child. They lack factor 8. It's a clotting factor. With hemophilia, what would you tell these people to avoid?
Aspirin.
Would they be playing NFL football?
Oh.
Too much contact. Another thing is their joints. If they do get a bleed, those joints have, it's called hemiarthria joint. They have blood that pools in the joints, so they have difficulty in movement, even though they may be getting this factor 8. They need to get replenishing of this factor 8 because they lack it for life. With hemophilia, remember, basically, genetically acquired, usually mom to male son. They're prone to bleeding also, but the highest incidence is when they have bleeding from contact sports. They can bleed into the joints. You want to prevent them from any type of injury. You limit giving injectable meds to them. Question?
Are these patients more prone to nosebleeds?
Yes. Because if you have a dry mucous membrane in the nose, if it cracks, they bleed more readily. If it's a female, God help her. That time of the month. God help her if she has to give birth. So you need to be ready. Yes.
Would a female like that want to use things when they didn't get period?
Oh, you mean the ablation surgery?
Like the ablation or there's a birth control that would
They may want to.
minimize.
Let me just tell you about ablation. It grows back. It can grow back. Okay. But they may try to do that.
Like hormone therapy or disease.
Is that true, or is it a myth that people with red hair have, are more susceptible to bleeding out and have some kind of?
That's a myth.
I've heard
That's
that.
a myth. I don't care. It could be blonde or black, but they can bleed. Okay.
And they do have souls.
Okay. No wonder red hair. At least that I know. Anyway, hemophilia needs to know how is it acquired, what would it manifest in the patient, won't you have them avoid, what do they need for life? Okay, Christmas disease is just one, it's factor 9. Hemophilia is the one you know, you hear about a lot, Christmas disease. a lesser incident. Okay? So let me just review some things, and then we will have the concept blending. Okay. Patient says to you, "Oh my goodness, maybe this will be toxic anemia." As the nurse, you know that what is going on at the cellular level and weight. In other words, what causes what may have occurred with a aplastic? There's not any production.
Oh, chemical
Chemicals,
alteration.
insecticides.
The production of red blood cells. Folic acid. Right. It's a B vitamin. Nutrient. Okay. What in the diet that you can have this
Vitamin B.
beans, grains. Okay. Patient taking oral contraceptives, what would you need to let? What's why that? They're going to have a problem with the absorption of folic acid. Iron deficiency anemia. You know, higher incidence with pregnancy, adolescence, infective process. What foods would you want your patient to choose if they had iron deficiency anemia?
Red meat.
Iron-rich foods. What modifiable behavior or habit predisposes a person to iron deficiency?
Vegetarian.
I'm giving a patient, I'm administering to my iron deficient patient ferrous sulfate. What are the, I might say, what are some needs that you need to take into account to some patients out? Taking oral iron. What would you do on discharge? What would you do? Might cause constipation. Might be tired stools.
Stain the teeth.
Hydration. Okay. What pertinent question would you have to ask me if there is the suspicion that we're trying to determine if this person has pernicious anemia, other than lab work? Have I been having anything? What if I've not done any lab work yet, and the person has diabetes? Which you've not talked about diabetes, but they have neuropathy also. What they would need is a lab value of their treatment. They need to have the lab value and the manifestations that correlate, which is a to determine if they have pernicious. Okay, patient comes into in a sickle cell crisis, meaning that they come to the ER, they're in pain, they're anxious. What's going on cellular level? What's going on in those blood vessels?
They're clumping up.
The cells are sickled because there's not enough oxygen carrying capacity. The cells are clumping together, which could become a thrombus. What may have precipitated that?
Cold.
Dehydration.
Cold, stress,
Stress.
Stress.
Did someone say cold water?
Cold weather.
Weather? Okay. Well, it might be water if it's red. But anyway, okay. So stress, dehydration, and change in temperature. Okay. Polycythemia. Someone goes to the mountains, and what have you. What might they exhibit? Shortness of breath.
But anyone in
Anyone
general.
would.
Yeah.
Anyone
So I don't
would.
understand that because there's
Okay, let me
no
just,
correct.
okay. Polycythemia though is this. Everyone's going to, but I'm not gonna give you that type of question because I know you fight.
Alright.
I
just don't get
Okay, polycythemia, think about it. You have these red blood cells, many of them, going through a determined vascular space. Okay,
And they're all
the blood
carrying
is
oxygen,
thick.
right?
They're all getting oxygen. But the thing about it with polycythemia, you know, the heart's trying to get that viscous blood throughout the body.
Okay.
So, they're gonna have, anybody will have a hard time breathing. But these individuals will have a hard time breathing because how was the oxygen quality? No. Traffic jam and you're stressed and everything else. Okay. I'm gonna stop right here and in the next 25 minutes or what have you, Professor Bethune, somebody's a nurse, I'm gonna be the patient, and I'm gonna have a disorder, and she's gonna show you, demonstrate to you, she may ask some questions as to what would you ask next, what would you do, and she already knows the disorder I have. So, we will probably ask you some questions. And so I'm gonna come out and go over there. You don't need a break or anything, we'll just go through this. I like to ask midway through my lecture, and I'm going to test. Are you able to follow? If you have any questions, do you notice anyone who asked a question, even though I looked at you twice back there? Anyway, I try to answer it. If I don't know, we will tell you. You notice a lot of times, even though one of you will ask a question, your peers try to, and I like that. Your peers will say, are you saying this? And they will help you understand. Okay, so, we'll make a transition. We'll take a little 2-minute little break at your seat. And okay. I'm gonna come in at the side. I'm coming out the side door. Yes, my question.
For Saturday's clinical for you, or is it?
Oh, yes, yes. Oh, thank you for asking. I don't want to talk. You will meet at the chapel. No. Better yet, meet in the cafeteria, private dining room. You guys know where that is? Meet there. She'll meet you there. 6. She may change it after a bit, but you're gonna be there at the same hours as anybody else. But remember, it's an early day. Remember? It's what you have, it's what you have, it's what you have. Skills. So you'll probably be there between 1 and 1:30. I'm gonna talk to her in 2 minutes anyway.
What happened was I fallen down.
Oh, no.
And I walked away. And yeah. So the last half, whatever she said.
Wait, just right now? Oh, our lecture?
Yeah.
All I did was talk about the hemophilia stuff. And the
One person in charge of it. Because when we break and we talk.
Don't pause it.
Look at your son.
I can't, when you guys.
No, break. We start
They
talking.
don't want it on.
And so one person needs to be responsible to come up here
I
and
got you.
pause it and then.
I'll post it too, so,
I am what I'm doing.
and Rob's getting it too. So.
Huh?
We've got other comments.
Rob and I post
Oh,
them, so.
good.
Fine.
But we just did the, like the hemophilia and stuff like that.
Did you turn it back on or you
And we've learned to turn them off because the student came back and said, you said this. And I have a tendency to say things that sometimes it doesn't come out like I want it to. Okay.
Yeah, right.
Okay. Anyway, let's set the scene. She'll set the scene.
Oh. good nurse and bad nurse or somewhere in between. I am going to ask her some questions based on how she's presenting. If I forget anything or omit something purposely, I may ask you to kind of help me out with where my thought process should be. Let me know if I did something that I was not supposed to do and exactly what it was and what I should have done. Okay? So watch everything that she does and everything that she does not do. See if we can figure it out.
Are you a nurse? Oh, man. Oh, I just walked from that parking lot. I can't hardly talk. The one where I couldn't get a car. My car in. Yeah, because I went around and I thought the door was.
You always get winded like this?
Let me think. Sometimes I do. When I go to the mall, I have the same problem.
So anytime you walk long distance, you have you need some oxygen.
I need some. Give me some water. I see you in there. Give me some water. I'm getting
So, do you smoke?
I don't smoke cigarettes.
You don't smoke cigarettes. What?
With my boyfriend, I kind of smoke. He told me I have to smoke. It's a real cigarette. It's not a cigarette. It's a joint.
Joints per day.
As many as he gives me. Usually two when I'm out.
Okay, now these joints, are they the little ones or are they the ones that are in the cigar paper?
He does it all himself.
And you just smoke, no questions asked.
It just makes me feel so.
Alright, since we're on this road, do you drink alcoholic beverages? A little or a little?
He drinks that, and I kind of share something.
How many half a little drinks do you drink a day?
Well, on the weekend, we go through. In the morning, we start on one. And then at night, it makes us feel good. We pick it up.
So all day.
Well, I said, morning and night, it's 2,000. Oh,
I take a break from the afternoon.
no. If we was friends and we go to somebody's house, they offer us
What did you have today before you parked your car and walked all the way around the building? Smoke anything, drink anything?
I didn't, but he out in the parking lot in the truck, he did.
So you were breathing it in.
Oh, yeah.
Does he smoke cigarettes at all? Regular cigarettes? Like cool?
He does both, but mainly it's those
You say you only get short of breath of activity. Walking around,
and other things.
such as. We'll just leave it at that. How old are you?
Well,
tell them you're thirsty. Do you still have a menstrual cycle? How often is it?
Too often.
So, are you entering the irregular phase of your cycle?
If you say every 2 weeks, yeah.
So you have a menstrual cycle every 2 weeks.
I have something.
Could you describe how much blood on an average day? How many pads do you go through?
When I ain't got pads, that's So I say I saturate the pad, and if I got no blood. I live on the east side.
Alright, doesn't matter where you live. You might want to cut down. Alright, so you saturate a pad. How many pads do you use now? You use a box of pads for 2 weeks. And then you have a week off, and then you leave for 2 more weeks.
No. I have a box. I guess they're economy box. And that's when actually.
So you use an economy box of pads, 2 boxes in 2 weeks.
One box, 1 week. One box when it comes in every week. It's mainly spotting. You gotta change the thing.
Okay, so first you said you saturated the pad, and now you said you're spotting.
I'm spotting, and then when I have certain activity, it starts.
Do you have any medical history? I need to read any heart problems.
Okay. Little hypertension.
A little. Any problems breathing, such as asthma, bronchitis?
I don't know if I ain't been diagnosed, but I sure get short of breath all the
Is that before or after your cigarettes?
With the cigarettes, it seems like I'm short of breath more, but I feel good after that.
How long have you been working?
Well, I've been with this person for 5 years, but the guy before that, he didn't. So I think that's great.
Now, any problems with diabetes?
Oh, my family does it. I haven't got checked for it.
So there's a family history for you. Any problems with kidneys?
Well, I know I've been.
Any problems with your liver?
Not that I know of.
No yellow under the eyes?
No, but mine. I don't know. My eyes get red.
Couple more questions that I need to ask you. What is your diet like? Would you like to eat?
My boyfriend made I can't afford that today.
Very answer.
We have a lot of weenie rolls, beans. We don't get too much salad. It's too expensive. But he cooks all that.
But just briefly, this is what I think we're gonna need to, do. We're gonna have to, after you see me, we're taking you to the back, they're gonna get some vital signs, and then the doctor's gonna come in and talk to you, but they're probably gonna draw take some blood from you, and draw some labs. It's a little concerning that, you get short of breath with, activity. Another problem is that you are 36 and you have a menstrual cycle every 2 weeks and you're really kind of heavy. Your extracurricular activities maybe be tweaked a little bit.
What's really changed? Okay.
Your age, 36, really 50. So, we need to look at that too. And then your diet, maybe after we get all of our diagnostic tests back, your lab work, probably do a chest x-ray, maybe an EKG. You know what that is? Yes, you've had one before.
They tried.
Hopefully you won't have to be admitted to the hospital. We'll talk to the dietitian, maybe, based on your income, you can come up with some creative ways to help you eat a, healthier diet. There's different things in the community that we can do to help you get fresh fruits and fresh vegetables. And maybe instead of frying everything, you can try to make some stuff. Maybe even boil.
Right.
Boil. You have a stove?
Yeah, we do.
In beans instead of ham hocks, maybe we can think of switching out that ham hock for something else, maybe like a turkey or smoked turkey.
Have you tried?
Yes. We also may have to test you for diabetes because you have a family history of it, and you said that you are urinating a lot. So
I said,
and I said urinating. See if that's a possibility. You okay with that?
what they gonna do about this leak?
That's for the doctor to decide. I don't know. How long has this been going on? That bleeding?
Uh, 6 months. Yeah, I've been tired and everything, but I don't drive. I let him drive me, and if he ain't gonna take me, I'm not gonna go. We don't have gas all the time.
That's really if you only get short of breath and tired when you move around.
Move around, any activity is where I can move around.
Have you ever passed out?
Well, I pass out all the time when I smoke those cigarettes. Not too much.
Yeah, you follow the point. Okay. Yeah, you might have to stay here a little longer than what I thought. Because you've been bleeding for 6 months and you're tired. But I need to ask my questions. If we put her on, we took her vital signs, what might her vital signs be? Low O2. Okay, so low O2. What else? Low blood pressure would be what?
High.
High. What else would be high?
Heart rate,
Heart rate.
Respiration.
respiration,
Okay. What labs are we going to draw?
H.
That's their CBC. What else? PT, DTT, INR. What else? Drug panel. A CMP. What are we going to be looking at in that CMP? Glucose and what else? What else is in the CMP? Protein. That's your CBC. All right, your electrolytes, your potassium, your calcium. We have glucose. What else is in that CMP? Huh?
I'll be.
Liver, and kidneys. So that's what I'm looking for.
BUN.
BUN and creatinine. So when you guys say CMP, you need to know what's in that CMP so you know what you're looking for. Okay? So when we talk about your CBC, what's in there? Red blood cells. What else? White. What else? Alright, if they do the CBC with the differential, that's when you're going to get all your little bitty cells, like your neutrophils, your eosinophils, your basophils. Your CBC is going to have your, what else besides your WBCs and RBCs? And what did you say? Yep, your H and H. All that's going to be in your CBC. So we draw these labs. What else might we draw for her besides the CMP, CBC, PT, PTT, and INR? What else? She's had a lot of symptoms.
Glucose tolerance.
Why are we doing troponin?
Because she's having trouble breathing with activity.
Okay, so wouldn't you might draw a cardiac panel? Okay, because what she's decreased perfusion, right? Is she symptomatic?
Yes.
How do you know? What did she say?
Can't breathe.
With activity.
With activity. Should anybody be short of breath with activity?
Walk.
Could I have gone further with that kind of questioning? Yeah. What should I have asked her? Any chest pain? What makes it better? What makes it worse?
Have you had it before?
Huh?
Have you had it before?
Have you had it before? What?
Activity.
How long does it last?
Well, we kind of got into activity. Well, I mean, like, you know, I mean, your heart rate's gonna go up if you're doing, she feels like how hard or how active.
Indigestion.
So, like, what activity specifically? Right. Remember, nobody should be short of breath with their ADLs, right? So, her bathing, her dressing, you know, or your IADLs, cooking, those kind of things. Nobody should be short of breath with that. And why are we doing an EKG?
She's had any heart attacks or
Okay. What is a chest X-ray for?
Pneumonia.
fluid in the lungs or fluid around the chest.
Okay, fluid in the lungs. But what else can we see on that chest X-ray besides the size?
Enlarged.
Size of the heart. All right. So all of this is kind of coming into play, right? We talked about cardiac, but now we're into blood dysphasias, and they're all still interconnected. Yes, she needs the urine drug screen, but and everything had a VAC and all that good stuff, but we probably already know what's gonna happen with that. What key things did she tell us that can kind of alert us to maybe what's going on with her? She's
Bleeding.
She's bleeding.
For how long?
6 months.
So what conditions can we probably think she's gonna have?
Iron deficiency.
Iron deficiency, and she could also probably be what else?
Be folic
Yeah, a
acid
whole lot of
too.
stuff, right? She's been bleeding for six months. What about her age? She's 36. But what happens with our ability to proliferate and make new cells as we get older? Decrease. So, what would an expectation be once you got her CBC back? Her H and H would be what? And her baby cells might be what? Immature cells.
Higher.
Can she make them as readily?
Oh no. They'll be lowered.
So she may have more of the mature cells, right? And then less of the immature cells. So like your little bitty baby white blood cells, whatever they're called, or stuff. Yes.
Would you be concerned about like a platelet disorder because what's causing her to bleed so much.
Could be diet.
And she said with activity, certain activity, so I'm thinking like she's bleeding during sex. I mean, that's not normal.
That's right, that's not normal. So then that leads us to our gynecological things, right? And as women, we know you expect our H&H to be a little lower during childbearing age. She's 36 supposedly, but you know, she's not of childbearing age anymore, so that's a concern. I don't know about that.
No. What I'm saying is people are starting in our society to wait.
Still
Oh,
childbearing.
yeah.
It's still child.
She said 36. But even you have people my age and older, I don't understand that, you know, having kids at 45, 46, or, you know, so, yeah, I don't get it either. But again, that is, anyway, what about her diet?
Bad.
What did she say? She ate a lot of
Fried
chicken, fried chicken, barbecue, all those, what kind of foods?
But it's red meat.
Saturated.
Cholesterol, saturated. She said ham hocks. Anybody know what ham hocks are?
Yeah.
Yes, you put them in your beans, you put them in your greens. They make the greens
More
fatty,
Really so
salty,
good.
but it's so
So
good.
good.
You slowly die as you do it. So good. Okay, so now we have some things that we cannot change about her. What can we not change about her? Her age, her gender, her ethnicity. So just by those things alone, she's predisposed to diabetes. And what does she tell us about diabetes? Okay, family history of that. What else do you know about African Americans? Hypertension, heart disease. Her diet is not conducive to that. Sickle cell, maybe, but she didn't give me any indication of that she was having a sickle cell crisis. So if she came to your unit, because she's probably going to be admitted because all of her labs are going to be off, what kind of orders can you anticipate the physician giving you to take care of her?
Oxygen.
Okay, she's probably going to be on 2 liters of oxygen, right? IV therapy, what has she lost? Blood, so she's lost fluid volume, right? So we need to give it back to her. What kind of fluid would you like to give her? All right, normal saline to start. If her H&H is oh so low, what can you probably expect an order for?
Blood pressure.
Some blood, all right. So then what additional labs do you need to have drawn?
Typing and
All right, type of screen, type of cross, all those things. What else can you expect from her?
Blood sugar monitoring.
All right, depending on what that glucose shows, we may have to put her on some Accu-Checks. Low sodium
There you
diet.
go.
What other kind of diet?
Who said that?
Low fat. All right, somebody iron. We want to get her iron level up. How can we do that?
green leafy
If we can't give her green leafies, what medication can we give her?
and pills.
Okay, give her an iron pill to take to kind of help build her up. Who is she going to need to see? A gynecologist, and who else in the hospital?
Dietitian.
Dietitian, and maybe we need to call who else?
The cardiologist.
Case management. Yes, she needs a little assistance that's far above what I am here to do for her. Okay, makes sense. This stuff help you guys think and make sense. So she stays. We get her hydrated. She sees the gynecologist. We give her a transfuser. Now she's getting ready to go home. She's been agreeable to all of our interventions. What is going to be the focus of your patient teaching?
Diet.
What did you say? Lifestyle changes. Now this is real life application lifestyle changes. She told us a lot. What did she keep? She said she did this, she did this, but she also followed it up with she couldn't do what?
Drive. No.
She
Money.
can't afford it.
She can't afford a lot of stuff. So for me,
But she can
that's
afford her
let
cigarettes.
right. Okay. Like quit drinking and get high, maybe you can afford some vegetables. Alright. But that's me. I don't know what's going on in her life, okay? So as healthcare providers and people who think we, know it all, we don't know what's going on with them outside of our realm. We see people for one snapshot at a time. We make all these gross assumptions and, insinuate this and insinuate that. We don't know. So if she's willing and agreeable to lifestyle changes and she needs fresh fruits and vegetables, what is a community resource?
Farmers market.
Farmers market, what else?
Sure.
Food stamps.
Can't get WIC unless you have kids under 5.
It is for women, infant, and children.
Food stamps.
If she's eligible.
Food bank.
Okay, a food bank. Who knows about bountiful baskets?
Oh,
Yeah.
Okay, so for $15, she can get fresh fruits and vegetables every week, right? Or depending on how many she has in her family, she can do it once a month.
.org.
What else do you need to tell her? Don't drink as much. Gradually cut back. If it's one drink a day, we're fine. Unless she has a medical marijuana card, then might be a good point. What else can you tell her? Dump her boyfriend. That might not be a possibility. But what else can you tell her?
Increase activity.
Okay, increase activity, increase fluid. What else? Is she gonna go home with the medication?
Yes.
What would you like to tell her?
Take it.
Make you constipated.
Take it.
What is it for? How to take
All
it?
right, you need to teach her what these medications are for. You need to teach her the doses. You need to teach it to her in plain, simple English, not the pharmacological ease that you speak. You need to speak it to her, make it tangible, make it applicable. Who else do you need to teach?
Her boyfriend.
Someone else.
She said he's in the car. Get him out the car. And you need to do the teaching together. Do you see her again?
Yes.
Probably.
Is there anything you can do about that?
No.
Start it all over. Yeah, if she doesn't have a primary physician, then maybe we need to help find a primary physician. If she doesn't have insurance, that's why it's called case management. Maybe she is eligible for state assistance and food stamps and Title 19 or whatever access. So those are the things that you guys need to be kind of thinking about, and not only in class but clinical. And you might even see some test questions kind of based off of which little things that we do in class.
Okay. Concept lending on Tuesday, I'll finish up the lecture. Concept lending, both of us.